Well, allow me to get in twice. I will log out here. See if the good old Mac works any better. For some reason, it's not enabling my camera. My apologies, guys.
No worries.
All right, hold on. Yeah, I'm not sure why I enabled the camera. I don't know why it's not showing. Don't know why.
No.
Let's try this one. You can see I do televisits, but obviously I do it without having to use Zoom.
I see.
So I don't have to do this very often, thank God.
On the bottom left by mute, is there a stop video button and a start
So
video
I have,
button?
yeah, the start video has been blocked out. When I say to start it, for some reason it says it cannot do it. I clicked the integrated camera. I went to video settings. I clicked the integrated camera. I clicked the original, is it HD original ratio? I don't know, let's just put this in here. And I said display. Yeah, I mean, I've turned it on. For some reason it's not on, but let me try this and see. Okay. Should I log out of you to get onto it from the Mac? Let's see. Let's try this again. All right. And of course, there's a bunch of stuff here. Come on. All right, let me see. I can get into the meeting ID close, don't. Let's see. Sorry, guys, I got like 10 windows I have to close up here. Hold on. All right, come on. My apologies, guys. And of course, my computer's not cooperating.
No worries, no worries.
I don't know what to tell you. If you'd like to start, we can start. And then if I figure out the video.
Yeah, for sure. That sounds good.
We can do that because I do that. I do that with my patients. So yeah. So
okay, for sure. That sounds good. So before we start, I'm just going to remind everyone just the requirements for the attendance credit. So just by joining this meeting, y'all are already going to get 1 attendance credit, and by asking a question, you can get another attendance credit, right? So me and my team have put together an interview, and we're so I'm just going to start by giving a brief introduction for Dr. Narayan. So she is an MD and a fellow of the American Academy of Allergy and Immunology and fellow of the American College of Allergy, Asthma, and Immunology. July 2004 through June 2006, she received her allergy and immunology at the University Medical Center. As for her education, she completed her medical training at St. George's University in Granada, her residency at New York Medical College, the Children's Hospital at Westchester, and the Medical Center, and her fellowship from July 2004 to June 2006 in allergy and immunology at Nassau University Medical Center. Dr. Narayan, thank you so much for joining us today.
Sure, of course, my pleasure. All right, let's
So,
see if I can get it going on here. All right, sorry, go ahead, Lohit. I'm otherwise ready.
definitely. So she's an allergist and an immunologist currently practicing.
Correct. For both adults and children. Yeah, let me know, how you'd like to do this. Am I speaking to basically pre-med, and I think Lohit has said pre-PA students in dental as well?
Yeah, so our organization consists of pre-PA, pre-dent, but primarily pre-med. So,
Excellent.
yeah.
Okay.
And
so everyone's kind of knowing what they want to do, or they're kind of still thinking?
I think everyone's still in college, so I think we're still deciding a little bit. What do y'all have to say to that? Are y'all set?
I think everyone's kind of in their own spot. I think a lot of the underclassmen are still sort of figuring it out. Those of us that are upperclassmen at this point have started to sort of figure out what we want to do. But yeah, if you made it this far in the pre-med world, then I think you're pretty set
on being
pre-med.
Right.
Yeah.
Sure. Congratulations to those of you who are graduating, by the way.
Okay, so Dr. Narayan, I'm going to start by asking this question. So,
Sure.
What exactly sparked your interest in the field of allergy, and were you always interested in the field of allergy?
So no, that's the quick answer. So kind of a little, I got in almost at the last minute, I'll put it that way. So I did a general pediatrics residency initially. And then I had pretty much set my heart. I knew I would never be a general pediatrician. I knew I wanted to do the I wanted to have experience in pediatrics, but I knew as I was going through first and second year of residency, it's a 3-year residency, I kind of knew that, this general pediatrics was not for me. I was a biochem major in undergrad, so I kind of wanted something that would integrate that into my clinical work. And I basically started doing a lot of rotations with the pediatric endocrinologist on staff. I trained in New York. So he worked through 3 hospitals in the New York area, starting from Manhattan to Brooklyn and to Westchester. A lot of driving for him, but essentially I got exposed to all, sorts of cases in peds endocrine. And I thought, that's what I'm going to do. And then about 2 years into it, so basically towards the tail end of my training, I did an elective in allergy, and I loved it. And it when you know. And it was just such a strong calling. And I said, this is exactly what I've been looking for pretty much during my training. And here it is. And I looked into it, and I had to hurry because it was the end of my second year, where we all kind of know what we're doing. And I had to look into it very quickly. And basically, the person who mentored me, and she's no longer with us, she passed away, but she was so helpful and guided me in the right direction and said, look, you got to basically get your rear in gear and head to the American College of Allergy meeting, which happened to be in the city that year. So she said, it's literally coming in a few weeks. You need to apply pronto. They do allow residents to go and participate. Usually you'd have to have some research, but even if you go for a day or so, you'll get a kind of a feel for what we do. So I went, and it was overwhelming. There's a lot of hard, bench research that is presented, but at the end of it, it is translated bench to bedside. And that's when I kind of realized this is what I want to do. I no longer want to do endocrine, and I switched gears. And I basically had to apply very quickly, because especially when you train in the pediatric field, at the time, there were only 70 slots available in the country for that fellowship. I don't know what it is now. So there really weren't a lot of positions. Internal medicine had 2 positions for every pediatric trained person. So I had to really scramble, get my kind of gear together. And then I ended up doing a gap year of research because for our field, we do need that kind of experience. And then I ended up getting my fellowship the year after.
Awesome. I think that's really cool how your future is like never decided. Like even when you're young, even when you're our age, right? You're always like wishy-washy, and then as you continue and progress throughout your career, you're always going to have that until you find
Correct.
your passion. So
Correct.
thank you. Does anyone else have any questions before we proceed? No. Jada, take it away.
Hi, I have a question, and that is, why did you choose to go to medical school in St. George's, and what advantages or disadvantages did that impose on you? Do you think it was harder to get into a residency because you were a foreign graduate?
Good question. So again, what I'm speaking of is what was at the time. So Lord will tell you, I graduated back in 2000, so it's been a while. So I will be honest, it was not my first choice, right? I had been waitlisted at about 4 or 5 schools. A couple of schools told me I was too young and I was the regular age of graduation. They said, oh, go get some life experience. A lot of our students are older, you know, work a year or two, do some research, do this, do that, get a master's, blah, blah, blah. I've always been impatient. I'm not somebody who, when I know what I want, I kind of just go for it. So I was waitlisted. While I was waitlisting, my father, who's a physician, was saying, well, why don't you apply to pharmacy, you know, and check that out. And I knew it wasn't something that I wanted to do. I wanted to go into medicine. I've always wanted to go into medicine since I was 10. So essentially I got impatient. I got admitted to St. George's, and the choice was, do I start my life or do I wait a few more months, 6 months or so, to see if I get admitted into any of the other schools? And I accepted the admission. As the other school results came in, they said, well, at the time it happened to be a very competitive year where, like, for example, 100 seats in a medical school, there were like 10,000 applications or something ridiculous like that. So the chance of me getting off that wait list was pretty slim, and I kind of knew that. So I planned accordingly, and I said, well, time is ticking. I still wanted to do residency. Chances are I wanted to do a specialty after. So I calculated the number of years it would take for me to finish and practice. And I said I did not want to wait another year or so to try for a US school. So I went ahead and did it. I will say, looking back, it was scary. There was no guarantee of anything, but I did do some research, and I had friends who had attended the school, and it is a US-based curriculum. So your professors were both American and from UK. Our clinical rotations in our 3rd and 4th year were in the States, and we could kind of pick where we wanted to go. So I was able to choose pediatrics at a children's hospital in Miami, for example. I did infectious disease HIV at the University of Maryland. So we were affiliated with certain hospitals in different cities across the US. So I didn't have to limit my clinicals to one city, one hospital. I could literally, obviously, you know, there was some lottery system involved, but I could try to pick and choose where I wanted to get my training done. And I thought that, hey, that's kind of neat. And surprisingly, or at least to my surprise, when I went down to the school, pretty much everybody was like me, very driven, wanting to be a doctor, you know, no matter what. Was it hard? Yes. And this was pre-internet, pre-cell phone. So it was, you know, it was a different time, but, and, you know, being away from the States, being away from the life, you know, and just studying, we focused and we studied, and all of us were hardcore, and we were all very driven, and that kind of helped each of us, you know, motivate us to say, hey, we want to get the best, you know, grades we can, the best USMLE scores we can. So because of that, getting a residency was not difficult, but we worked really hard. I will say that. We had a 98% pass rate, and I think it's continued to this day. So the pass rate is quite high for USMLE step 1. But yes, so basically not my first choice, but I would do it again if I had to.
Awesome. Before I ask anyone else if they have a question, I just have to ask really fast. By going to Granada, what is the medical system like there? Because now diversity and knowing the diversity of how different countries practice medicine is a huge thing. Do you think that helped you actually going to Granada and like seeing how medicine is in like a different country other than the US? Did you think that expanded your diversity and made
I
you
think
better?
so, but to be honest, studies, like our classes, were all American based. Okay, the books we used were the same as what we use here. Our professors were actually from states, so they were from medical schools here, and then they would go down and teach, immunology or anatomy or whatever have you. And then we'd have the professors that would be there permanently year round. When it came to our preclinical, so I would say the end of second year, we did get to go to the hospital and do like, a quick stint, like a mini clinical OBGYN, infectious disease, general surgery. At the time, their facilities were not that great. So, for example, when we did OBGYN, there were 5 of us in the delivery room with that poor woman, watching her deliver her baby. And the things we take for granted, oh, we can just open up a sterile kit and everything is in there, your forceps, your gauze, your everything. That at the time, they had it and it was clean, but they didn't have it in abundance. And I kind of feel like here we take it for granted that there will be 50 gauze in the inventory closet, that we will have, sterile everything available to us, ready to go. So there it was, we have it, but we have yay number of patients that, that need it. So we're going to have to really make sure we are smart in how we use what we use and use it for the patients that truly need it, kind of thing. So in that sense, yes. Also, tropical diseases are a different thing. I came from the Northeast. So I didn't experience, I wasn't familiar with malaria, dengue fever, all that. So we did see a few cases, and of course I wasn't allowed to get too close. But we did see that. So, and then when I was interested in the children's ward, so I'd spent some time in the pediatric ward. They didn't have peds beds. Their peds ICU was all cribs. So even if you were 6 years old, you got a crib, as long as you could fit in it. Because that's what they had. So, and the cribs were, if you imagine from what we would say in the States from the 1950s, those, steel cribs that were white with the bars. That's what they had. So I think we take for granted a lot here. And I think that as I grew, as I trained, you keep that in mind so that when you are on the floor, when you are doing your residency or clinical rotations, in a US hospital, you see that what we take for granted, wastage, this and that, whatever, the technology, the supplies that we have, it makes you think, that, oh my gosh, I have 50 gauze in front of me. We could have used 2 that day and I didn't have it. So it really does make you think. So in that sense, I did have some of that experience. Did I get a lot of tropical medicine experience? No, not at the time.
I see. I'm actually very much considering St. George's as well as a lot of my fellow peers. So thank you for that response. I feel like it was a very detailed response. Thank you. Does anyone else have any further questions at this point? No? Okay, Garrett, you can take it away now.
Hello. By the way, to all the underclassmen, we really do encourage you guys to ask questions. I mean, this is a very open format and everyone here has the same interests. So, there will be no judgment on questions or anything like that. And we have this here for you guys. So really, if you have any questions along the way, don't be afraid to chime up a little bit. But earlier on, you addressed that you and your peers all sort of motivated each other to work really hard, and that being away from the US, you could kind of dial in on the material you had to focus. What sort of study habits did you develop as a student, both in undergrad and in medical school, and even as a medical professional, to gain all of the honors and the awards that you have achieved?
Good question. So I'm not gonna be very helpful because as Lohith will tell you, I'm a nerd. Okay, so I'm gonna be very upfront. I've always been a nerd, so I'm not the nerdiest of nerds. I'll put it that way. I kind of think of myself as one of the dumber ones on the spectrum. But what I do lack maybe in my IQ, I make up for in diligence. I am relentless. And what I mean by that is when I know that I need to do something, I will give it 150%. And that's just how I've always been. And that's, in everything that I've done. And that's That's just how I am. So when it came to applying for medical school, I applied to, what I thought to be a good amount. I thought I was, I'll be honest, I thought I was qualified. And it was a little embarrassing to me that I was waitlisted, because I didn't think that I would be that person. And to my surprise, when I did end up going to medical school, everyone felt the same way. They all thought, well, we shouldn't be here. We should be in Vanderbilt. We should be at Duke. We should be at Cornell. We should be at blah, blah, blah. And everyone was pretty much in the boat that I was in, where our scores were good, our grades were good, we had our extracurriculars. We'd done everything that we thought was right. So for us to just continue to, work hard, and I will tell you, as I've gotten older, I've learned to work not just hard, but smarter. Working hard doesn't always get you where you need to go. You also need to work smarter. And what I mean by that is efficiency. I think times have changed, technology's changed, expectations have changed. We do need to get things done. And one thing I had to learn very quickly in residency, I'm a slow worker and I'm very tedious and meticulous. And when I got to residency, you don't have the time. In our residency, we didn't have what we call cap on admissions. So however many you got when you were on your 30-hour shift is the number of patients you got. You couldn't say, well, I'm done at 10, call it a night. No, you got 50, you got 50. So you better get a move on and get from the ER to the, to the floor, to wherever you had to go. And make sure that you don't muck it up. Make sure you don't mix up your patients. So essentially, like I said, it's just motivation, proper organization, time management. These are all key that you're going to, you need it now, and you're going to pretty much need it the rest of your life. So I would just say that would be it. And then of course, as you get older, I think I didn't do it as much when I was younger, but as you get older, you realize you need to make time for yourself. When I was younger, I had a lot of energy and I wanted to just do it all, right? You want to do research, you want to go to every clinical, opportunity you get, you want to volunteer, you want to do everything. And that's great. And you should make use of every opportunity you can. But at the same time, you don't want to burn out. You want to make sure that you take time to sleep, time to decompress, time for self-care. Those are important. On the flip side of that is opportunity comes once. So if somebody offers to, hey, try this and see, don't be afraid. You never know. Like, had I not done the allergy rotation, which was honestly just a last minute elective on my part, I probably wouldn't be sitting here today. So take it if you can, if you're not burnt out and you have the time. Study, do your work smart and do it work efficiently. Time management, you're going to need it over and over again. Organize yourself, organize how you're going to do it. What's priority? Prioritize what's most important, what has to get done immediately. Because as a physician, at least, you're going to have to think on your feet a lot. You're going to have to change gears a lot. You think a patient's going to need blah, blah, blah. And then the next thing you know, they're crashing and now the plan's changed. So you need to be able to adapt to your situation, think quickly, think clearly. And those were the skills we started out with when we were younger. We're not so good at it, but I think as we get older, we hone those skills, and that serves you well as you get through your training.
Thank you. That is very insightful. And I think a lot of us will take from that. One thing that you mentioned, and we were kind of waiting to get into this later, but you brought it up, so I think we can bring it up now, is you mentioned burnout. And that's a really big issue that I've seen a lot of undergrads go through it, as well as medical students. Mm-hmm. And what exactly did you do to sort of, keep yourself accountable, and how did you avoid burnout? Like, what kind of hobbies did you have? And I think a lot of people are, again, like you said, very, very energetic about this and want to take every opportunity they can. I think every freshman pre-med that I've met, right. And then, they get hit in their face with their first bio exam and yes. It kind of goes off the rails for a little bit. So what exactly did you do to keep yourself focused in a healthy way?
Good question. You're talking about like an undergrad or med school?
Both. I mean, okay. I'm sure it was different for both. So
exactly, you hit the nail on the head. So yeah, undergrad's very different because undergrad, I had friends who were not pre-med, who were not pre-science at all. So that was they kept me grounded, even though I resisted a lot. But yeah, so yeah, they'd pull you in a different direction, and I'd be like, I don't have time for that. But looking back, I wish I had more time. I'll put it that way. But yeah, so I guess in undergrad, it was more of friends help to balance you out. I tended to want to study alone because I knew if I would hang out with my friends, I would end up talking to them. But they would definitely pull me out and say, hey, it's Friday. You can do this. You can take a break. Nothing's going to happen. It's not going to affect your grade tomorrow. Your life's going to be fine. Take a break, even if it means just going out for dinner. It didn't have to be a prolonged break. It didn't have to be, let's go to a club. It didn't have to be something, wild and crazy. It could have just been like, hey, there's a movie at the student center. We're going to go get some pizza, small stuff. And then of course, yeah, we'd go for the big stuff too. So that was one. Two, I've learned Indian classical dance, which is kind of like saying ballet, if you want to look at it that way. And as one of my jobs through college, on Saturdays, I would teach that to 9 to 14-year-olds. So I had that responsibility every Saturday morning, 9 to 1, to teach a dance class. And I loved to dance. So that was physical. It was mental. It was totally different than anything I was studying. It gave me a break. And in my high school years, I was a varsity gymnast. So here and there, I would go to the sports center and I would tumble in the open space. I would do a couple back handsprings. It sounds silly, but that's what I would do. Do a couple back handsprings, do a couple flips, go swimming, work out a little bit. Probably could have worked out more, but that's essentially what I would do besides, hanging out with your friends, to kind of just break it up and just to do something fun. I'm shrugging my shoulders. You can't see me, but I am.
Oh, thank you. That was a good answer, I think, for a lot of people who tend to oftentimes surround themselves only around the pre-med community. And there's nothing wrong with that. I think it's important to have that community, but I know a lot of people kind of get sucked into the hole of always studying. I know that I've gone down that road. I know I've gone down that road with Lohith where we've, been in the library on Friday nights and kind of looked around like, what are we doing? So yeah.
Definitely, 100%.
And I'm so sorry, guys. Lohith, I'm so sorry. I tried to put in the meeting passcode again on my Mac. It's saying incorrect. So I'm just going to keep going. I apologize.
Oh, no worries at all. No worries.
Because I comb my hair and everything. But anyway.
Oh, no worries at all.
Does anyone else?
I'm not missing anything. I'll put it that way.
Does anyone else have any questions at this point regarding, study habits, burnout, etc.?
Even about the field, anything. Jay, did you have your hand?
Question.
Joy.
Sure.
Oh, I'm so sorry.
Oh, no worries. Joy, did you have a question?
Go ahead.
Well, my question was like, do you do any of those hobbies that you did in medical school and as an undergrad now, or are you kind of just really busy with, family life and work?
Good question. I will say definitely for me, and I know a couple of my friends who have been able to keep up here and there. My life is kind of complicated right now. So, it's just between work and I'm raising 2 boys. My younger one has autism, so he takes up a lot of time. Life changes, right? So we all have, and when I was your age, we all had this idea, and I'm going to kind of direct this to the ladies. We all had this idea that we can do anything, right? We can do it, we can handle it, we can do it all. And I was one of those. I said, I'm not going to let anything stop me. I'm not going to let family stop me. I'm not going to let anything stop me. I'm going to do everything. We're going to keep up everything. I'm going to do everything I always did the rest of my life. Yeah, that doesn't happen. Life changes, right? You have different demands on your time. You have different things that are going on. Residency was its own bear. So that is a different life in itself. Post-residency, I have kept up a little bit of my dance training. I last performed in Houston in 2015 with a group of the seniors. Oh God, I feel old. So we did do that. That was kind of fun. Can I still do a back handspring? Yeah. Should I? No. Injury risk is not worth it. So I have other things I need to take care of nowadays, so I can't afford to break a leg or my back. So I do yoga instead. Hey, so I can do that. So those things, you know, do not have the same, how shall I say, importance in my life that they did at one point. There's a part of me that wishes I could do more of it, but there's also a part of me that has grown up. And that there are other things. Now I kind of focus on, well, my kids have their activities. I want to make sure they get to their sports. So kind of feel like the focus is not so much on me doing my extracurriculars as my kids doing theirs, if that makes sense. So now I'm more into, okay, let's see what they, you know, they have this competition or they have this lesson or whatever. So we have those demands on our quote unquote free time. And then whatever leftover time there is for me, sometimes it's just nice to be quiet. I'll put it that way. It sounds boring, but when you get to a stage where my job is to talk all day to patients, not having to talk to anybody is a really sweet thing. Hopefully that answers some of your questions.
No, it definitely did. Thank you so much.
You're welcome.
Joy, do you have a question?
Yeah, I was just going to ask your advice on picking undergraduate minors. I've heard both ends of it. People who don't pursue a minor that they really wanted to in undergrad, they kind of regret it. And they say, I wish if I could change one thing, I'd go back and I'd take that minor that may not have to do a lot with the med field. And then other people who maybe did make that choice or see the consequences of doing something not related to the med field say, don't ever do that. Choose something you can use as a major, or choose something you can use as like if you don't get into med school and you need to have a job, do something along those lines. So, I mean, what would be your advice or your experience from knowing other people who maybe did make that choice or didn't make that choice in terms of like curriculum?
Sure. No, that's a great question. I can only speak to the side of the coin that I was. So I was a dual major, biochemistry and religion. The religion was by choice. At that time, the biochem also kind of by choice, but more because I knew I was going to be pre-med. And I did not want to be a bio major. So there you have it. Looking back, and I did graduate with a BS in biochem and a BA in religion. Looking back, I wish I had done just the religion. Meaning I could have done the biochem courses without having the BS in biochem. I really didn't need to have level 501 as an undergrad. I didn't need that. And I think I really worked harder than I needed to. And if I could go back to my younger self, I would say, stop it. You know, do the courses that obviously your prerequisites you have to do. If you want to do a few more biochem classes after that, do it. This is the time in your undergrad years. This is the time of your life where you can and you have the permission to do whatever you want. If you're going to go into medicine after this, your life will start to get very narrow in the sense of what you can do and the time you have to do it. So, for example, if you want to pursue anthropology, okay, you know, obviously you're going to do, you know, I think, do you guys still have like a counselor or somebody who like a pre-med counselor who kind of got, okay. So, you know, they're going to kind of tell you, these are the things you have to do. And then the rest is what you want to do. So make use of it. If there is something, you know, you're like, man, I really want to do a finance course, do it. This is the only time you really can. Later in life, if you want to do an MD, you know, MBA, so be it. But when you're at this stage and you have the option to do something that gives you joy, do it, because either way, it's going to enrich your life, and anything that enriches your life, whether you go into medicine or not, is going to benefit you as a person, and who you are as a person translates into who you are as a professional. So for example, now I deal with patient care primarily. I'm not an academic physician. So I take on my whole life experience when I talk to a patient. So kind of like how I'm trying to kind of, I hope, relate to you guys at where you are in your life. A patient comes to me and says, hey, you know, I have a 3-year-old daughter. I have to go pick her up from gymnastics. We'll use that as a bonding point. And I'll be like, oh, is she learning cartwheels right now? Or is she learning back handspring? What's she learning, you know? And that helps to build a rapport. It helps to build trust. I can, I hope, relate to them on a certain level. And that gives me insight into what they do. Like, for example, when I see a new patient, one of the questions I ask them is, what do you do? Because every patient is different. The way I treat asthma in one person will be very different than the way I treat asthma in another. And that will depend on what they do, what their interests are, what their hobbies are. They'll say, well, you know, I'm a stockbroker by day, but I'm an artist by night. Well, that tells me a lot too. So that way, when I speak to them, when I treat them, it gives you a more holistic way of looking at things. And I think that whether you become a physician or not, I think that's useful in life, you know, no matter what you do. So I think at the end of the day, no matter what you do, you have to be able to relate to other people. And the more either extracurriculars you do, or the more that you study outside of the pre-med field, I think can only enrich you. So yeah, if you want to go do a minor in anthropology, you know, and you do your prerequisites, go for it.
Thank you.
You're welcome.
I'm gonna now divert the center of topic into the field now, right? So what are the best and worst parts of being a pediatric allergist and allergist in general? And also what is like one of the coolest stories, or one of like the most eye-opening, if you could share with us from like allergy itself, from the field?
Ooh, that's a tough one because there's so many. There's so many. So just real quick to let you guys know. So when I finished pediatrics, and then when I went on to my specialty, if any of you are interested, allergy, asthma, immunology is not a pediatric specialty, nor is it an internal medicine specialty. It's kind of both. So when I went into fellowship after 3 years of only doing children less than 18 years old, suddenly I was seeing 80-year-olds and 95-year-olds as a fellow. So we do see everybody. So I tell people birth to death, essentially, all ages. So in one way, for me, that's a good thing. I didn't want to be limited to just children. So essentially, you know, when we do this, we're kind of, how shall I say? Oops, sorry, Lohit, 1 second. Let me put you back here. All right.
No worries.
Sorry. So, sorry, your question was basically to say how we, say it again.
Yeah, so what is like the best and worst parts
Yeah.
of being
Okay.
a allergist?
So
And
yeah,
also,
that's
like,
one
a
of the
cool story.
best. Yeah, that's one of the best, is that for me that I get to see both kids and adults. With regards to stories, too many. Right, well, I'll put it to you this way. So in fellowship, we'll start there because that's when I became an allergist. In fellowship, I trained in Long Island, and there we saw patients who were both uninsured, illegal immigrants, really, you know, on the poverty line. And that was kind of newer for me. I had trained in pediatrics in Westchester, which was the opposite of that. It's a very affluent community up there. And then, you know, suddenly I'm thrown into the depths of Long Island, where I'm seeing patients who tell me, you know, I'm not here legally, but my asthma is real bad and I can't breathe. And, you know, we treated everybody. You walk through the door of the hospital, you got treated. That's just the way it is. So it was interesting when I had, and, you know, we saw the gamut, because you would see the most severe cases of everything, of HIV, of asthma, of immunodeficiency, of anaphylaxis. You know, you see, unfortunately, you see violence, you see drugs, you see fear, you see, you know, teenage pregnancy, kind of all the things that you know, if you were growing up in suburbia and kind of isolated, which I was, you may not always see all of that. So it was culturally very different for me, and I had to learn very quickly. And also you would see people of different backgrounds. So I had to learn very quickly how to approach a family who, for example, was of a very Orthodox background. And as a woman, I couldn't shake the father's hand or show, or hug him when his child died. That was not culturally acceptable. So, you learn very quickly that this is acceptable, this is not, and you have to learn on the job. There's nobody teaching you these things. So you have to use your own intuition and kind of learn. So that was a big waking up call for me, that we're, people who are very different than yourself. You are treating them, you are advising them, you are trying to get them to, to trust you, and they, and they're looking at you like you don't know anything about me, and it's true. And you basically have to find common ground. So I think that was something that I had to learn on my feet through the 2 years of fellowship. And there were a lot of cases, a lot of patients where I had to learn that skill. And did I mess up? For sure. And after I messed up once, the second time I knew, this is what you do and this is what you don't do. So there are cases where patients, could not afford their medications. To this day, I still see that. In my practice now, I see insured patients, so it's a little bit different. So I've had patients who are so grateful to have care of any kind. And then I have the patients who are very affluent and very privileged, who treat you kind of like you do their bidding. So unfortunately, and this may gonna go into another topic, but medicine unfortunately doesn't have, in my opinion, the same respect it did 10, 20 years ago. People think with Google reviews that, they can tell you what to do. I'm still very old school. I kind of, Google reviews are fine, 5-star reviews are fine. But if it's based on, is the patient satisfied because you gave them what they want and not because you did what was right? I don't agree with that. So it's very different. There's so many stories I couldn't even tell you, but as you go through training, just encountering people who are sometimes even the opposite of you and finding common ground, I think has been kind of the basis for the most interesting stories.
Thank you. That was super insightful.
So one comment I kind of wanted to make, and correct me if I'm wrong, but I think a lot of people in the pre-med world and even in the medical world, especially in your early 20s, they are very concerned about missing out on life experience. There's a lot of people who think that, like, I'm not experiencing, the real world or anything like that. But it kind of sounds like, through the patients you're exposed to and the situations you're put in, you have to learn to adapt to. You kind of do get that life experience, but amplified and intensified.
Oh, yes,
and
for sure.
I think that that's something that hasn't been communicated to a lot of undergrads, because they're always like, man, when am I going to get out there and, meet people, see things? Whereas, you're going to get that through the medical training. You're just going to get a very unique form of it.
Correct. I know it's hard. It's easy for me to sit on this end of it. When I was sitting where you guys are, I was, jumping out of my seat. I couldn't wait to do this. Looking back, I could have waited. Enjoy and savor the moments you have not being a physician. And the reason I say this, not because I don't like it, I love it. I wouldn't be sitting here if I didn't. All of this, your whole life is what's going to make you a good physician or a good healthcare professional. All right. Everything is an experience. Your whole life is going to be the experience that you take with you. So, your cultural background, the way you were raised, the community you live in, what you've done in your spare time, the friends you make, all those are really important. And I think when we're, pre-med or pre-healthcare, we're studying for whatever, we're so laser focused, and you should be, because, the grades matter, and unfortunately the MCAT matters. But at the same time, don't disregard where you are at that stage of life. You are in a unique position where you still have the opportunity, like I said before, to explore other things. You have the time to do that. You do, believe it or not. Make the time, make the time, because this time where you guys are right now will not come back. And when you're, old like me, you're going to turn around and say, man, I should have done that pottery class. So everything you do, whether it's volunteering on a Saturday, babysitting your nephew, I mean, whatever it may be, is an experience, and it's going to add to the flavor of your life, and it's going to make you ultimately, I think, a good professional. So study hard, study smart, but time management, plan out time to do what makes you happy, and make the time. I think with classes and studying and MCATs and everything else, it can just bulldoze you, and make some time. I wouldn't say go partying all the time, no, because you can't do that. but set aside a Friday night and be like, okay, I'm gonna go do this. I've been looking forward to it all week, and this is what I'm gonna do. Do it. Make use of it. Make use of the time. Hang out with non-medical friends, because they give you that reality check you need. Medicine is going to be your life as you move forward. It will be. And so when it's not your life yet, make use of it.
I think that's actually pretty profound, and that can be applied to a lot of areas of life. So thank you.
Sure.
Anyone else? Does anyone else have any questions before we proceed?
Yeah, you mentioned earlier that when you were 10 years old, that's when you knew you wanted to go into medicine ever since you were 10. And I was wondering if you ever had any doubts if that that was what you wanted to go into, and if you did, how did you reassure yourself that that was the right decision?
Sure. All the time. I'm not gonna lie. So for me, I grew up in a town called Rochester, New York, which is in upstate New York. I don't know if you guys are familiar. It's at the time it was even smaller than it is now, medium-sized city. Not a lot of career prospects. So, Bosch and Lomb, Kodak, Xerox were all based there. So there are a lot of people who are in engineering fields. My father, he was a general surgeon, now retired. My uncle was an internal medicine physician. So I kind of saw the engineering side, I saw this side. I really wasn't exposed to a whole lot of other fields. So at 10, I drew a picture and I said, I want to be a cardiothoracic surgeon. And I thought it was the coolest thing ever. And then that evolved into wanting to be an orthopedic surgeon because of my gymnastics background, because I had friends with multiple injuries. So I thought that was cool. So I did, this was before undergrad. So this was all through school, and I thought, okay, this is what I'm going to do. And the other thing was, my parents were pretty conservative, even though, we had probably, we were very comfortable financially. As a kid, I was kind of restricted, and I'd be like, hey, I want to buy the latest sweater, I want to buy the latest shoes. And my parents were like, nope, when you grow up and get a job, you can buy it. So I said, great, I'm going to be a doctor, I'm going to buy my own shoes. so that was how I thought when I was a kid, that would give me, financial freedom. It would give me, job satisfaction, all that. Undergrad came along and it hit me like a ton of bricks. And I said, wow, this is hard. This is really hard. All the hoops you have to jump through, the dedication, the time it took. And I spent a lot of time studying. Probably I should study more. But I did spend a lot of time studying, and I feel like I could have studied actually not longer, but better. I don't think I studied quality wise. I think I just spent too much time reading books, which I honestly found a waste of time. Don't tell this to your professors. I could have studied more efficiently than reading like 50 pages a night of organic chemistry. So I think as it evolved, I'll put it that way. So we go through undergrad, we kind of feel like, I don't know. And then you take the MCAT. And for me, I hit a really dark spot when I was waitlisted and obviously rejected by some schools. Then you start to wonder and you say, you know what, is this really for me? Maybe this is the higher power telling me, don't do this, do something else. And there was doubt. For the first time in my life, there was doubt. And I was saying, well, if I don't become a physician, what the heck am I going to do? Because I'm not good in math. I had no interest in law school. At the time, I really didn't want to go to pharmacy school. I'm not, as Lohit will tell you, I'm not a big fan of animals. So vet school was not an option for me. So it was kind of like, what am I gonna do? I don't have finance, you know, in my blood. I didn't know what else to do, and I had to do something, right? We have to have a job. So yes, there was doubt at that point. And then I said, well, you know what the heck? I'm just gonna do it. And I'm gonna see what happens. So that pretty much was it. And I just kept going. So yes, is there doubt? For sure. And then as you go through med school, you always look to the other side, which is residency. In residency, there was doubt again. Residency kicked our behind. I'm not gonna lie. Residency, those 3 years, depending on what you do. Our residency was particularly tough. We were on call every 3rd day. We would have that golden weekend, as we called it, which was the one weekend that we actually had a weekend. And yeah, my first year internship was hard. Life was not normal. There was no life. I lived in the hospital. And it was, you know, it was really unpleasant. I'll put it that way. All of us were unhappy. All of us were working too hard. We all worked in 30, 48-hour shifts. You know, we had nasty senior residents, and this is pediatrics, mind you, not even general surgery. So there's always that doubt, but it tests your mettle, and it tests your loyalty, and it tests your drive. So there are multiple times to quit, for sure. But in the end, if it is your calling, you will go through it and you will finish.
Thank you so much for that.
No problem.
Jada,
One
do you?
thing.
Yeah.
Sorry, I don't mean to interrupt.
Oh, no,
I
go
think
ahead,
one had
go ahead. Yeah.
But you said in those moments in residency and your internship where it was incredibly hard, people were very unhappy, but you all had the same goal. What sort of conversations were you having with yourself in those moments where, you know, you might want to quit, or all you can think about is, you know, crawling into bed, that kind of thing? Because I think that is something that we all experience at a much lesser level, and you have to find a way to motivate yourself. So what were you telling yourself? What kind of things were running through your head? Did you have sort of something that you fell back on?
Good question. Part of it is, you know, it's going to end in 3 years. All right, being very blunt. It's not forever. You know that you're going to have a job, and residency doesn't last your whole life, right? At the time, it feels like it does. That's one. Lucky for me, I had 3 really close friends in residency, and our residency was such, like I said, this was before the Bell Commission. I don't know if you guys are familiar with all that, but now there's laws in place saying you can't, I believe, don't quote me, that the ACGME has come out saying you can't work more than a 24-hour shift. None of that existed back then. It was on paper, but it was not enforced in academia. So we all worked, I would say, minimum 30 hours, which doesn't give you a whole lot of time to do anything else. So yes, you'd go home, you'd sleep. What would keep you going? You know, friends. And these were friends that tended to be in the program with me. So we all knew what we were going through because we were all going through it together. So I had 3 really good friends who would literally be like, okay, I know you're post call, you get 6 hours to sleep. We're going to call you and we're going to wake you up and we're going to take you out. So against my will, a couple times they would bang down my door and be like, we're leaving, get dressed, get out of your scrubs, get dressed, take a shower. And they would literally throw, I'm like, what are you doing in my room? But yeah, so they would literally throw me and I'd be like, I'm in that mood. I just went, and nope, you're going to go somewhere, even if it means we just go to CPK and have a pizza, we're going to get out of here. And I think, you know, and hopefully I did that for them as well. That was that. And then on top of it, my final, actually not my final, towards my, this tells you how old I am, towards my first year, end of the first year of residency, I got married. Okay, so my husband is not a physician, and it was an adjustment for him to see all of this. But definitely when I came home, I was a normal, quote unquote, normal person. You know, you leave your scrubs at the door and you get on with your life, and you know, in my case, I was a wife. I was a newly married person. You know, enjoying my married life, but at the same time working 30 hours and exhausted. So, you know, you add that to the mix. That's, you know, another factor that you are looking into. You're starting a marriage, you're doing residency. It is a lot to handle at once. And I had a few colleagues who had children during residency. I knew I did not want to have kids during residency because I don't think I could have handled it. But there are a few of my colleagues who did. So unfortunately, it's the age where everything happens at once. So professionally, personally, there's no good time for anything. You either bite the bullet and do it, or you postpone it, and that has its own implications. But yeah, so friends, I tried to work out. I probably could have worked out more. I tried to work out. That helped a little bit. Just getting out of the hospital, getting out of the apartment, anywhere, was just great to see, like normal people in a non-hospital setting.
Thank you. Yeah. Again, I think it's important that everyone has something that keeps them going in those moments where they don't think they can keep going, whether that's an internal or external force. Sounds like you had great friends.
Yes. We're still friends to this day too, which makes it even better.
That's awesome. Anyone else? Any questions? No? Okay. So although it may be out of your specific field of research, what information have you heard via colleagues and general experience regarding the effects of the vaccine of COVID? There are a lot of people who are concerned about like allergic reactions regarding COVID and the vaccine. And are also obviously a lot of like fallacies out there. What is your opinion on this? And also, I noted you performed research with alveolar epithelial cells, right? So has that made you think about COVID in a different way or with a different light? Or do you have a little more insight onto COVID?
Sure. So actually, it does fall in my wheelhouse. And since this began about a year ago, I'm gonna, not to brag or anything, but Dr. Fauci is one of us. He's an allergy immunology physician. So he had spoken to our group, I should say, a couple years ago, way pre-pandemic. So definitely since last March, we've been included in webinars at the CDC level, through the American Academy of Allergy, through the American College of Allergy, because COVID impacts the inflammatory system. And that's why you get the blood clots and the respiratory issues and all that. So what I do is I treat patients who have immunodeficiencies, who have respiratory issues, and who have chronic inflammation. So there you have it. COVID came along, and of course my office was flooded with questions and calls saying, well, I already have X condition. What do I do if I get COVID? Am I going to die? What's going to happen? So when it came very quickly, there were some researchers who mobilized, as we know, COVID testing and all that. And then as allergists, what we started to do when the vaccine came out was compose an allergy test for the vaccine. So since, I think probably now it's been about 5 months or so, we've been doing vaccine allergy testing for the components, which include polyethylene glycol and polysaccharide 80. These are the two, what we think to be, meaning from the UK studies and from studies so far, these are the two components that seem to trigger the anaphylactic reaction or allergic reaction due to the vaccine. So we don't have the vaccine to test for itself. We're not privy to having that, but at least we have access to the components that are the triggers for anaphylaxis. So what I've been doing is, let's say a patient got their first vaccine, they started to get hives or maybe some respiratory issues or anaphylaxis, what have you. Then I bring them into my office and I do allergy testing for those components to see, are they truly allergic or was this a side effect? Big difference between, after the vaccine. And then once we, do the testing, if they pass, we can say at least with a good degree of certainty that they can tolerate the second vaccine and not have anaphylaxis or an allergic reaction. Can you still have joint pain and inflammation? Yes, of course, that can happen, but at least you won't have anaphylaxis. And then I've had some patients who have anaphylaxed to the polyethylene glycol component. And I say, you're not going to get that second vaccine. Before the Johnson & Johnson was suspended, I would say, well, you passed the polysorbate 80 test, which is a component in the Johnson & Johnson AstraZeneca vaccine. And then therefore, you cannot have the Pfizer or Moderna, but you can have AstraZeneca and Johnson & Johnson when it comes out because it was early. So at least we can guide them that way. And that has been really helpful. That study was literally, the ink was still wet when we started doing the testing in office because we needed to work quickly. The Journal of the American College of Allergy came out with a working paper, and we all used that as our protocol to do the testing months ago. And now it has actually become a full protocol. Of course, we explained to our patients, look, this is a work in progress. This could change tomorrow. But as of today, this is what we're using. This is what we're working with. Science has to be fast nowadays. And we are very open with our patients and say, this is what we know this minute. Tomorrow, I may say something else. And it doesn't mean that we're confused. It just means that science knowledge is evolving, especially when it comes to the virus. So it does impact the immune system. So we had a lot of, questions from my patients on that, because I have a lot of patients who are immunodeficient, and I don't mean HIV, meaning they have poor immune systems that they were born with, or as they have aged, they have kind of evolved into their immunodeficiency. So, they all had questions about how can I do the vaccine if I don't have an immune system? So every day, that is pretty much what we are dealing with in our practice. And COVID has taken over a lot of the questions that patients had. We've been trying to keep our asthmatics as healthy as possible. Unfortunately, during this year, a lot of them stopped their medications and their asthma got worse. And then they would call me and say, well, I've got COVID, now what? So, a lot of it on our part, and I'm not in the ER, I was not front line. I call myself in front of the front line. And what I mean by that is we were trying to prevent patients going to the ER to begin with, and keeping them, either like, you can't see me, but doing a televisit or, doing a phone visit, or having them, rarely at that time coming into the office, and managing them that way. So yeah, basically, this is what we're doing. We don't have the vaccine in our office to administer, so they were getting it wherever they got it. But certainly we told them, please give us a call if you have any reactions to it. If there is something we can do to prevent you from having the next reaction, we will. We will do some testing, what have you. If it was a matter of just reassuring them and saying, well, body ache is expected, fever is expected, these kinds of things are side effects of the vaccine and not a allergic reaction to that. Just educating patients on what is quote unquote an okay reaction versus what is not an okay reaction. So that has been our role during this pandemic when it came to COVID. Over here back, I think it was back in April of 2020, the Dallas Morning News interviewed me as an immunologist to ask me how it affects the immune system. And yes, in people who have poor immune systems, they are going to be more prone to getting sicker. When they do get the vaccine, it may not be as robust a response as somebody who has a healthy immune system. So there's a lot of factors to play in this. And when patients say, I have questions or concerns about the vaccine, we certainly arrange a time to discuss it, because I think the media scares people sometimes. And it's not a cookie cutter. Everybody should follow what the media says or this or that. I'm all for the vaccine. I think it's really important. I've gotten my Modernas back in January. However, there are some people who should not get it. And they're not that many, but there are some. So I think it's really important that, the public be educated from their physician. Yes, you can watch the news, you can go on the internet, you can look at social media, but at the end of the day, talk to your doctor about your individual case.
Thank you. I think that's super cool, because we usually don't hear too much about like everyone's always telling us, hey, get the vaccine, everyone get the vaccine. But coming specifically from an allergist, I think it's very cool to hear your perspective on saying it can be a symptom of the vaccine rather than just
Correct.
an allergic reaction. I think that's really cool. So everyone, y'all are all free to go if y'all choose to, because we've already hit the time limit. However, if anyone else wants to say, get questions in, then we can do that as well. So y'all are free to go. I've taken all of you down for attendance, but we're going to continue to proceed otherwise.
We actually had one more question that ties in pretty perfectly with where we left off with the last question.
Okay.
And it was, given the current political situation surrounding the virus and the vaccine, a lot of conspiracies have popped up around the vaccine, and a lot of them are coming from areas that, have no basis in science, or from individuals that have no scientific background. And a lot of it's been inflated by the media falsely a lot of the time. So what are your opinions on some of the conspiracies surrounding the vaccine, and what is your view on such a large number of people being skeptical of the science and motives behind the vaccine?
Good question. And it's a tough one. I'm not gonna, for sitting where we sit, we think like scientists, right? So when you think like scientists, you think everybody thinks like a scientist, and that's not the case. So yeah, when I think probably more early on, but still, there was a lot more resistance. I found myself kind of doing what I am here in the sense of one-on-one education. They would say, hey, I watched this on the news. Is this true? Is that true? And it was up to me to put it into terms that was relevant to them, that was relevant to what they could understand, their lifestyle, their diagnosis. So I try as much as I can, and it's not easy to take the politics out of it, right? In our office from day one, we never closed in our office. So from day one, we did require masking, we had PPE in place. I did reduce a lot of the patients coming into the office. So we did a lot more of the video visits, televisits, that kind of thing, and tried to limit exposure of everybody. Social distancing, we had to limit generally the number of people who came in. So I would tell patients, look, we are taking it seriously. We are using these precautions, and that is to protect you, to protect me and my staff. Because at our level, what it's one thing to say it in a general sense on the news, but it's a whole nother thing when it's in your house or in your office. So what I do say is, look, I explain to them, for example, what is in each vaccine. So I tell them, the mRNA components, for example, in Pfizer and Moderna. I do tell them about J&J. And I say, this is what it is, and this is what it isn't. And when it goes into your body, this is what it can do. And this is, pretty much breaking it down into not such a scientific term, hopefully something they can relate to. And that way, I'm hoping to take the politics out of it and say, this is what it is when you look at it. Did it come out quickly? For sure. Do vaccines normally come out this quickly? No. Could there be bugs in this? Yes. Like anything else, there is always side effects to everything. And have we had 10 years to study this vaccine? Gosh, no. But when you look at what has happened to people who have had serious COVID, and maybe even, mild COVID, we don't know yet. It hasn't been that long. Compared to what we've seen with people who have actually gotten COVID, the vaccine side effects really look to be minor and short-lived. So 5, 10, whatever years from now, if you had COVID that was lasting 3 weeks, could you have Alzheimer's, or could you have chronic respiratory issues? We do not know. So I tell everybody, compared to actually having that virus, which already has damaged multiple systems in your body, if you get a vaccine that has an mRNA component in it, it doesn't have any inactive virus, it doesn't have a virus in it, and it helps to boost your immunity and to protect you 95% after your 2 doses. Why not? Can I guarantee you there won't be a side effect? No, I cannot. Because yes, it came out very quickly. It had to. And next year, we're probably going to have another vaccine. We're all probably going to have to get vaccinated every 6 to 9 months or so. So next year's version will probably be better than this year's version. And that's how it is. So it's not perfect. It's not going to, I hope for now, at least they're saying it covers the variants. Future variants, probably not. So is it perfect? By no means. But if it allows society to get back to a stage of some kind of normalcy, right? As humans, we're social beings. If we can somehow get back to some kind of normalcy where we have nothing else to protect us, the masks are there, sure. But at the end of the day, we are sitting ducks. So if you want to get to that normal, some kind of normal stage of life, we need something, and just doing nothing is just not an option. It's killing people we know. It is, affected the whole world. The whole world is affected. And we need to be, as human beings, proactive and do something. So if you say, I don't want to get my vaccine because, this political party said this, it is your body. It is your family. It is your community. It is your life. So don't look at the guy on TV who's like, I'm not going to do this because of this thing. Chances are he probably got his vaccine. So, what is said in the media is not necessarily true. Do what is right for you. And yeah, if you have a strong, religious preference or a strong thing against the vaccine, that is your choice, but if you are open to it, it will at least help you to get out of your house, to have some protection, to be able to go see other loved ones who've been vaccinated. It is doing something as opposed to doing nothing and just staying status quo and letting the virus, take over. So I try to bring it on a level that is to say, at the end of the day, do what's right for you, but this is what it is. Go to the facts. Don't look at anything else. Don't look at the emotion of it. These are the facts. And if you want to get from point A to point B, you got to do something. So what are you going to do?
Thank you. I think it's a good way to look at it and a good way to sort of put it in context, because I think, as with most things, the media blows pretty much everything out of context or takes things out of context. And when it gets to be involved in the political world and there's power and money involved, a lot of people will, create these fallacies or create falsehoods that can really influence people in a negative way. And to your point, we have to sort of wonder, given that the vaccine isn't perfect, is it, still better than people getting COVID? So I think it's a really good way to frame things.
Yeah, and that's literally what I tell my patients. I still have most, I will say right now, I would say probably 90% of my patients have been vaccinated, at least one, if most have had two. There are a few who are just, nope, I am not doing it. Nobody can make me, and I do ask them, and it's not to be, confrontational or anything. I just say, what are your concerns regarding it? I'm scared of getting sick is usually the answer. Oh, my friend's grandma got really sick from it, so therefore I don't want to do it. And I tell them, there's a lot of things that everyone reacts differently to. It depends on your body metabolism. It depends on your medical conditions. Talk to your doctor about your individual body, about your conditions, because if your friend's grandma nearly, as she said, quote unquote, died, which meant she had a lot of body ache and fever and that kind of thing, that may not be the case for you. So you can't, one bad egg doesn't mean everybody's going to have a bad reaction. So can it happen? Yes. Most of the time, thankfully, it doesn't. So I just said, get educated, talk to your physician, get all the facts first, then make an educated decision.
John V, do you have any questions? Any last minute questions? I don't think so. Dr. Narayan, thank you. You don't have any questions? Okay, awesome. Dr. Narayan, thank you so much for taking the time today. I feel like we got a very personalized.
I'm so sorry. I kept doing the video as we were doing this, and my apologies. I'm not so, but for whatever reason it didn't work. So you didn't get to see my makeup today, but I had good makeup on. Anyway,
no worries at all. That was a fantastic conversation. Thank you so much. And Dr. Narayan, we're also recording this, and we plan to put it on the website along with just a brief description of yourselves, just for our other members to watch at their own convenience. That'd be all right.
Oh, of course. You know, I've taught students at different levels all the time, and I almost feel like it's our responsibility to, as older generation, to kind of help you guys out, because we're on the other end of this. And when we were at your stage, life looked very different. There was a lot of uncertainty, a lot of, you know, it was scary to say, am I going to get in? How's it going to be when I get in? You know, everyone's story is different. Somebody else's story will be very different than mine. But I think my parting words of wisdom to you guys, in whatever you decide to do, don't do it for financial reasons. Don't do it for status. I can't speak for other healthcare, but at least in medicine, it is evolving, and not necessarily in a favorable way for physicians. There's a lot of other healthcare professionals who are essentially trying to take over the job of a physician without the training and the education and the experience. So we didn't talk about this topic, but as you guys go through your training, you will have challenges that we didn't have. And we're starting to see that now. So by the time you guys get to where we are, I hope it will be better. But there is a lot of threat to physicians in America. And that comes from a lot of things. It comes from litigation from patients. It comes from quote unquote competition from other healthcare professionals who want to be like physicians and be treated as physicians, but are not physicians. It comes from corporate people who run, the administrations for different medical practices and hospitals. There's a lot, and you probably heard this from other talks you may have had with other physicians, but there's a lot of threat to your future career. And that will depend on how much you guys care, okay? And in the sense of, do you believe in your specialty? Do you believe in being a physician? Is your loyalty, is your heart there? For example, in my office, I've had several pre-PA students that worked with me as scribes. And I asked them, I said, I think you'd be a great physician. And they would flat out say, you know what, I think I'm going to go to PA school because I can basically do what I need to do it faster, less expense, and get to where I need to go. So if you are, going to be a physician, do it with your heart and do it, with your eyes wide open. And take care of the specialty, because when I retire, I'm going to need you guys to take care of me. So, and we want to see a physician on the other end. We want to make sure we're taken care of, and America is taken care of by a physician, because, we are the best trained at this. That's just the way it is. So those are kind of my parting words to you guys.
Well, thank you. That's very, very insightful. And we always appreciate the wisdom that we can get, because, at this stage, particularly in COVID, where our interaction with physicians is kind of limited right now,
Sure.
we rely on formats like this, and any and all exposure we can get is always appreciated, particularly when people are as sociable and willing to answer questions as you've been. So thank you again.
Sure, my pleasure.
Thank you so much.
Yeah, thank you so much for the work that you do and the time that you've put into your job, your career, and your education. You seem like you've gone through it all, really. And like, you've taken criticism like it was no one's business, and you're still going, and you're still here, and you still love your job, and you're still doing it with your two boys. Like, thank you so much for your time today.
It's my pleasure. And I always tell people, even when I was in med school, and they'd be like, oh, you're so noble. And I said, no, I'm very selfish, because I want to be a doctor. And I always looked at that. I said, it's great helping people, but I want to be a doctor. They're like, oh, you want to help people? And I said, yeah, that's one of them. That's one of the things. I've had other, I've had other young women come to me when they were finishing their undergrad and say, I got admitted, but should I do it? And I said, well, no one can answer that question but you. If your gut, your instinct tells you to do it, you should. If there is a doubt, yeah, you know what, it's not for everybody. When you join med school, they always tell you, look right, look left, one of you is not going to be here next year. And that's true. The dropout rate, I don't know if it still is, but the dropout rate was pretty high. And yeah, not everyone made it through those 4 years, either because, you know, the grades, the lifestyle, or they were just like, you know, I don't want to do this anymore. And if you don't want to do it, that's okay. That is fine. I think it's better to know earlier than, you know, 10 years into it. But, you know, if you want to do it, you will know you want to do it, and you should. And I would not, you know, other people say, well, would you want your kids to go into medicine? And I say, only if they want it. I would never force it on them, nor would I tell anybody else, you know, oh, well, you've done all your pre-meds, well, you have to. No, because I had a few friends who were quote unquote forced by their parents to do it because they thought it was a noble profession. And they said, you know, you'll be happy. And you know what, sure enough, they quit. They got the third year med school and they quit because they said, well, you know, I'm going to make my own life decisions and this is just not for me. So you have to have that sustainability, and that can only come from you because it will challenge you in every way possible. Life will not be easy with medicine. Medicine is not a job, it's your life. So you have to make room for other things in your life with medicine. And I think at least that was the way we looked at it in our generation. I think this generation may be a little different, meaning the generation's younger than mine. I already see a difference in mentality. Like when we hire new doctors to join our practice, they're like, well, you know, I don't want to work weekends and I don't want to be on call and I don't want this and I don't want that. And to us, that sounds kind of silly because we're like, well, that's what you signed up for when you did this. So yes, you want to have a balance, but also there is an inherent being a doctor that is part of this. So, but yeah, we do the best we can. At the end of the day, like everybody else, you do the best you can.
That's something we've kind of started to address, I think, in MSO more than honestly the other pre-health organizations. It's part of the reason that I've stuck around is, you know, the kind of person that goes into medicine doesn't go into medicine for anything other than the medicine, or like, you know, approaching it with a servant's heart and truly being there for your patients and knowing that you want this for your life and you want your life to look like this, because there's a lot of really smart people who can be doctors, and those smart people can make a lot of money and can achieve a lot of status in a lot of fields that don't take your life the way that medicine does. So
Sure,
we've
for sure
started to communicate that more a lot in MSO from what I've seen. Other pre-health organizations, I'm sure, have that to some extent, but I know we put a lot of emphasis on it here.
I think that's great because I don't think that was fully explained to us when we were doing medicine and even residency. We learned in a bubble. We had this academic bubble where, you know, this is what you did and that's how it went. And then suddenly one day you wake up and you have to work and you're not really sure how to translate your education into a job. And the job, you know, when you go out, and I'm speaking as in private practice, when you go, you finish your training and now you're interviewing for a job as a real physician, you've grown up and you're now going to get a real job. We're not always prepared. And that was one of the things I said at my exit interview during residency and fellowship, is that you didn't teach us the business of medicine. So that when we were negotiating a contract, we didn't really know how. You know, we knew how to do the medicine part. I could manage DKA, I could manage an asthma attack, I could manage all that. But how do I negotiate a legal contract to sign up for my first job? And we didn't know what tail coverage was. There's a lot of things that we're not taught. And I think, I hope in current medical education, they will start to teach that too, because you need to know how to function in the real world when you're done with academia. You know, that's part of it too. And unfortunately, you don't know it till you get there. So some people, even after they reach private practice, change their mind and say, I don't think I'm going to do this. And now you guys have a lot more options because of technology and where we are in the world. There's a lot more options. So you don't have to just be a private practitioner or go into academics, or you have other choices as well. You have pharma, you've got other things. But yeah, at the end of the day, you know, explore your options, find out what is right for you, what serves your lifestyle, where you want to be, how you want to live your life, and go for it.
Dr. Narayan, thank you so much again. That was Really good
Thank you. My
advice.
apologies, guys. I'm a dud when it came to video. I don't know what happened here. I'm gonna have to ask Rohan what happened. I have to ask my 10-year-old what
No
happened to my
worries at
video.
all.
So my apologies. I do this in the dark the whole time. Thank you guys for inviting me. Thank you for everybody who is there. I hope it was of some use to you.
Definitely.
Of great use. Really,
So-
thank you.
Really, really great use. Thank you.
I wish you all well. Good luck in everything you do. Hopefully one of you will become an allergist. We need more of us.